It went from being okay one day, within like 24 hours, I nearly lost my life. I'm Kelly, I'm 36 years old. I live in Kent and I've got 2 children. So back in the days, I actually climbed Kilimanjaro, I did lots of scouting activities, I was really sporty. I never expected my life to change. Late 2012, I was getting a lot of resistant infections, trying lots of different antibiotics. In January 2013, my cultures came back and they were only sensitive to antibiotics. So my GP sent me in for some IV antibiotics. I looked quite well initially, so they just gave me like 1 dose and sent me home. I felt a lot better, and then a couple of days later was when I became really poorly. I basically had really bad tummy pain, felt terrible, it felt like my heart was racing. So I called my mum and she took me up to the hospital. It kind of all just went from there. Within 24 hours of being in A&E, I ended up in HDU and then transferred to ITU, in which I nearly lost my life. My parents were called in the night because they said I might not make it to the morning. When I was in ITU, I was really worried about dying. I remember the consultant, I said to him, am I going to die? And he held my hand and he said, Kelly, he said, you're really poorly. He said, but we're going to do our best for you. And to this day, I still remember those words, you know. I also remember I had hallucinations in ITU that felt really real. I felt like I was being held hostage at Buckingham Palace. I felt like I was being used against my will for medical research. It was really scary, yeah. When I got discharged from the hospital, it was still really scary. I just felt like, you know, am I out of the woods or am I gonna go back in? Even all those years on, it's changed the way I do things. So like I won't be at home, sleep at home on my own at night. Really does play on your mental health. Sometimes when you're getting infections and they're constant, you think you're alone, but actually there's loads of people that are going through the same sort of thing. I was walking into Boots one day collecting my prescription and they had a poster up at the pharmacy. So I screenshotted the picture and then basically just looked it up and then it kind of just took off from there, and I've had so much support from the charity. I got involved with the peer support sessions and they have been brilliant. Having those peer support sessions made you aware that you're not the only person, that there's lots of other people like you. There was a stage last year where I was getting lots of antibiotics. I needed to keep going in for IV antibiotics or having IVs at home. At one stage I was given an antibiotic and the charity questioned why I was on that antibiotic and why I wasn't on something else. So she helped me advocate and I called my doctor and my doctor promptly changed the treatment plan, and then I ended up going into hospital and having IV antibiotics again. So NHS waiting times are really long at the moment. I don't think that it should be the responsibility for the patient to seek private care, but when you're struggling and you know you've tested all other means, then where else do you turn? I went private. It's not necessarily that I had the money, but I found the money because at the end of the day, you're searching for an answer. But healthcare was meant to be free from the point of birth, really, point of access. Having sepsis made me want to give something back, so I decided that I wanted to go into nursing. My experiences definitely impacted the way I think and the way I interact with my patients. So I feel like I can better understand their condition and where they're coming from. Just having that little bit of knowledge, you know, if someone's a bit anxious, say for example about self-catheterising, I can say, give them a bit more information about that and say, well, no one would know you're self-catheterising, and kind of give them a bit of my story in a roundabout way. Listening to the experience of the patient is important for healthcare professionals. It's really important for them to feel empowered, you know, and feel like they're in control, because at the end of the day, it's their body. I still struggle with infections and resistancy. It's a long tunnel, there's a light at the end of it, you've just got to find it. You know, find out if there's support groups, utilise other things that are going on, and most importantly, make sure you're heard by your healthcare professionals. You are your best advocate.